Hi, let's talk health services and IT. For many years now, electronic medical records has been the holy grail for IT support. And sadly, it has not really delivered. It has increased the administrative work for clinicians. All research shows that it increases the total operating cost for providers, and it does not ensure ironclad handovers either, one of the main issues when it comes to security and better outcomes. So we have built something quite different. It's based on a process engine, so it handles the patient information and workflows past one entity through the whole system, from primary to secondary, back to primary, to therapists, to pharmacies, ambulances, the whole thing. And it creates electronic medical records and more automatically through the activities. So everybody that touches upon a patient actually is part of writing the medical records. Let's have a look at how that works. I'm logged on as Nancy. She's handling reception at private practice, and there's a patient passing through the door, so let's enroll that patient. As this is a demo, I don't have many patients in the system yet, and normally I would then add a new patient here if it's the first time. But if the patient has touched any provider anywhere within the health system, he or she would be here. So let's choose Peter Smith in this example. And of course, Peter has been there before, and thus he has a case from the old days, and I can read all about it in case it's a recurring issue. But this is a new problem, so let's add the details. So we have completed that, and we have to add who will get a request, because we go for pull instead of push. We do not assign, we let people pick it up. That is a way smarter queuing mechanism, and people are more happy with it because they can take and pick up anything that when they are ready. I have to log out and put on my hat, my Lu hat for example. And here we are. We have a request. We can read all about it and we can take it over. Let's proceed, at which point it's removed from the request lists everywhere, and also from the awaiting handover list here, because every case must have one single owner at each time. Thus we can ensure full accountability and ironclad handovers. And of course, when you get that casework, you get all the information you need, including the full medical record, even from the old cases, which has then related objects like X-ray, medication, and so forth, easy to navigate and automatically built during the process or the flows. And Lou is working with Peter here to find out what's happening. So he has to make some physical examination and some plans. And we can set a preliminary diagnosis, of course. This is a very simple version of it, but we will embed a full diagnosis library here, ICD-10 or some other, depending on what's preferred. And next step, we got all kinds of choices here. Now the thing is that Lou at his little practice doesn't have an X-ray, so he decided to hand over the patient to the local hospital just as well, as they have all the equipment. So he's going to do that, and we have a list here of hospitals, not many, but I'm going to choose one. And we have to select the receptionist, and the urgency is urgent and complete. And now I have to log out. And log on again as Marion. And she has a booking, please schedule. And we can do this pretty quickly. We can do it in 2 hours at noon. And now she will see that she has an incoming patient. In the meantime, of course, Lou at the practice will get a message, as would the patient in his own patient interface. So let's skip a couple of hours forward, and we're still logged on as Marion at the hospital, and Peter comes through the door with his bad arm. So we're going to admit this patient now. And we have to hand him over to a diagnostician. And for that, as we have already selected the specialities, we get a list up and we choose Jack or Lars. And in the meantime, we have to place Peter. And we see that awaiting handover is because now Marion is the owner of the case, so she's responsible, and here she can change urgency and add more requests until somebody picks it up. So I have to log out again and log on as Jack or Lars. So we logged on as Jack, and he has a request. He can see all the details, X-rays needed, etc, 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 and he's going to take over the case. And the moment he does that, again, it's removed from any request list, and also now it's no more in the waiting handover for Marion list. It's now owned solely by Jack, and he's fully accountable and responsible for this patient. And of course he can change the diagnosis at any time, but first he'd do some X-ray, and he requests once. Get a message that it's done, and he's back to diagnosis. But in the meantime, his request is visible, because you always want to know what's happening. And you can see that John and Lars has the request, and he can add more requests as we did earlier. And now we're waiting for the X-ray. We get that back. Once that's finished, it's automatically a part of the medical record. Also, Jack will get a message directly in his interface that it's done, and he can proceed with his diagnosis, and when finished he can then hand it off to nurse with an instruction to plaster, or if there's a need for surgery, the same thing with instructions for the surgeon, who will have a somewhat different interface where he can set up a surgery, book the operating theatre, put together a team, and so forth. And at the end, any of those can then discharge, or he can discharge, Jack can discharge. And when you discharge, you have to set the status of the case. So it's healed, it needs to get back. So when it's discharged, the receptionist will set a new time for taking the plaster off, say. Or if it's a chronic disease, then it has to be handed back to a primary care physician that will have the patient in an observation list for chronic cases. And so it rolls back and forth, and the medical record is built all the time. Everything is in here, patient administration systems and so forth. Everything is covered. There is no need for any other system. And as I said, it's all built for a small tablet. It can even be done used on a smartphone for anybody. All right, thank you. I think that was all. Bye.